Dear ladies and girls and gentlemen, thank you very much for inviting me to speak to you today. It is a little strange talking to this machine instead of you, but I'm really happy that we have this opportunity. I would like to address what tape can do for menstruation pain, pregnancy, labour and high heels. The more we know about skin, the better our tapes will be, so please let me tell you a little bit about skin. As you can see, the skin characteristics change with age, and as a youngster, your skin is thinner, as the elderly patient's skin is also thinner. Skin changes during your life, meaning you might need different brands of tapes during your life, and I will talk about the test patching later. I am presuming that everyone in this audience knows the skin and knows the properties named at the top of the slide. But there are some other ones that are not really named in any textbooks or atlases, and I would like to share them with you as well. The first one is that the skin actually allows for movement, something that is an open door but we need to realize. Research into the effects of scarring after burn wounds have shown us how this can restrict our movement. The second one is that skin always moves in a certain physiological direction, as shown by Fukui. Colleague Fukui researched the movement of skin intensively and wrote about it in his book called Skin Taping. His research and many ideas have been published. It really is a book I recommend. And the third is Dr. Ginbato's work showing us how skin cells move. Ginbato has shown us that skin cells actually change shape during stretch and come back to their original shape after the stretch has been removed. This is amazing, and you can view this on Vimeo and YouTube. The film is called The Skin Excursion. Really recommended. Knowing all these properties makes understanding how tape works a lot easier. And then parts of our skin are connected to organs through reflex zones and the various meridians. Knowing the anatomy and physiology of our cutaneous nerves also makes understanding what tape does easier. Diana Jacob has actually mapped all of these nerves, and you can read them in her book. Please realize that when we tape, we are taping on skin, so knowing your anatomy is really necessary. We are not applying tapes to joints, to ligaments, to muscles. We are applying tape to skin. And the fun part is we can actually use tape to activate or influence a number of things. The applications I will be discussing can be used to activate function, decrease pain, increase blood and lymph flow, and influence organ function, which is really interesting. I think the research of tape and the effects of tape on the human body are the most important ones for you to learn. As you can see, a lot of different research has already been conducted. Ultrasonic imaging, for example, has shown the effects of skin stretch on the underlying muscles. I would like to show you this video that I was very grateful to receive from Professor Fukui from Japan. His ultrasonic imaging you will be seeing, and you will be seeing how we copied this research of his and tried it again in the clinic with the same results. We are seeing the patient flex and extend his knee. This is the position of the imaging probe, and in a minute you will see the position of the hand that is now going to do the skin stretch only. In this case, the patient does not move. If this is a good place, then I can apply my tape instead of my hand. So on the top left you can see the skin moving a little, and you can actually see we activate muscles just by stretching the skin. Patient is not moving. fMRIs, MRIs, 3D motion analysis, blood samples all show the effects of tape on the body. Knowing your research is a must as far as I'm concerned. But now let's get to the clinic. Let's start talking about taping. We humans have 6 skin types as far as I know, and we will need to take this into consideration. That is why I'm very much in favour of using test patches first before we apply tape to the patient. I think it is wise to have a number of good brands in the clinic, which you can then test patch on the various patients you have. A number of studies have been conducted comparing the mechanical properties of tape, and they all show that tape does differ. Every brand and even every colour of a same brand differ as far as mechanical properties is concerned. No studies have been conducted into the skin's reaction to tape, and therefore I recommend using the gold standard that dermatologists use, which means applying tape and leaving it on for 2 days, removing, waiting a day or 2 to judge the skin, because we always remove epidermal cells when removing tape. We often see vasodilatation as a result, which is not the same as an allergic reaction to the glue. This is an example of an allergic reaction to the tape's glue. You really need to remove the tape if this happens. By far the most studies have been conducted into the effects of taping on menstruation, pain or dysfunction. I'm very happy to be able to tell you that most studies show that there is really a good effect on pain and discomfort. The first study ever conducted was done by Weavers and colleagues, and they applied tape to the stomach and the lower back in a region related to the reproductive organs. The skin is always stretched before applying tape, so in the case of the lower back, the body will be flexed. I have used this application a number of times and have found that the colour blue actually works best, and that we don't need to apply on the stomach all the time. If there is a real pain in the stomach, yes, apply tape to that area. In most studies, the tape brand or the tape colour is not even mentioned, making comparing a little difficult. As you can see in this slide, a number of studies have been conducted looking into problems related to pregnancy. Colleagues around the world do not agree if it is safe to use tape on a pregnant lady, yes or no. I recommend talking to the doctor first to make sure that there are no contraindications. The first 2 studies show us that low back pain related to pregnancy can be treated effectively. Using tape to address the diastasis recti abdominis after pregnancy is a good idea. I do not know of any studies that have been conducted looking at the effects of taping the diastasis recti abdominis during pregnancy, and I know of a number of cases of ladies that have done so without any problems. Combining tape with exercise has proved an effective method to reduce labour pain. I would have welcomed that. A second study is being conducted at the moment looking into the effectiveness and safety during labour and delivery. Pain, satisfaction of the patient, obstetric and neonatal outcomes will be looked into. So I'm glad to tell you that yes, there is sufficient evidence and experience showing that pain and discomfort caused by menstruation, pregnancy and even labour can be addressed with tape. I'm not sure how many of you in the audience actually wear high heels. I used to as a young girl, but I stopped doing it. Being a physio, I quickly understood that this was not the best manner of transport. But for those of you that do wear high heels or treat people that wear high heels, yes, tape can help. Please be careful. Do not just start using tape. Get some education first. Read about it before you do anything. Use test patches, find the best brands for this specific patient, and take care of the skin. Every tape is a sensory stimulus, a 24-hour-a-day stimulus. Make sure you're right. I can truly say that having learned how to use tape, having learned more about skin, has really helped me help patients be more effective and efficient, and it has saved a lot of time. So thank you very much for your attention. I hope I have made clear that we can use tape for many things, including the very feminine problems. Thank you again and wishing you well. I hope you really enjoy the whole conference, and I hope I've been able to tell you a little bit about what is possible and get you interested in using tape. Bye bye.